Hi, good morning Phillips. My name is Mihira. I'm your invigilator for the OET-speaking session on the 10th of July 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record please?
My full name is Philip Strauss.
And what is your candidate number?
My candidate number is 2552552.
All right. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Thank you for the verification. Now, let's move on to the warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Can you tell me more about your nursing education and training?
I have a Bachelor of Science in Nursing degree from a reputable university, where I learned the theoretical and practical aspects of nursing. I also completed several clinical rotations in different settings, such as medical surgical, pediatrics, maternity, mental health and community health. I gained valuable experience and skills in providing holistic, patient-centered and evidence-based care to diverse populations. I also completed a 1-year residency program at a large hospital, where I received mentorship and guidance from experienced nurses, and enhanced my clinical competence and confidence.
As a nurse, what message would you give to the aspiring nurses of the future?
As a nurse, I would tell the aspiring nurses of the future to be compassionate, resilient, and dedicated. Nursing is a noble profession that requires a lot of patience, empathy, and skill. It is also a rewarding career that allows you to make a positive difference in the lives of others. I would encourage them to pursue their passion for nursing and to never stop learning and growing as professionals. Nursing is not easy, but it is worth it.
What are some challenges that nurses face?
Some of the challenges that nurses face are inadequate staffing ratios, which leads to heavy workloads and mandatory overtime, low salaries compared to other professions, and a lack of recognition for their contributions to health services, emotional involvement in their patients' lives and outcomes, which can be a difficult burden to carry over many years, feeling unheard by management and struggling with meeting patient expectations, workplace violence from difficult or aggressive patients, keeping up with technology and changing standards of education. These are some of the challenges that nurses face.
How do you stay up to date with the latest developments in nursing?
I stay up to date with the latest developments in nursing by reading nursing journals and magazines, such as the American Journal of Nursing, Nursing 2023, and Nursing Made Incredibly Easy. Attending nursing conferences, seminars and webinars, where I can learn from experts and network with peers. Taking continuing education courses and online modules, following nursing blogs, podcasts, and social media accounts also helps me in this. Seeking feedback and advice from my colleagues, mentors and supervisors, who can share their insights and experiences with me. These are some of the ways that I stay up to date with the latest developments in nursing.
How do nurses contribute to research and innovation in healthcare?
Nurses contribute to research and innovation in healthcare in many ways, such as designing and conducting research studies that address relevant clinical problems, generate new knowledge, and improve patient outcomes. Applying evidence-based practice to their daily work, using the best available research findings to guide their decisions and actions. Developing and implementing new technologies that enhance healthcare delivery, such as predictive models, telehealth, electronic health records, and smart devices. Serving as co-designers and co-creators of healthcare and their roles in the public health and healthcare systems, collaborating with other stakeholders and patients to identify needs and solutions.
Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihira.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihira.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET-speaking role play. Don't worry if I stop you when the time is up.
Hello, I'm Philip Strauss, the nurse at the Community Health Center. How may I help you today?
Good morning, nurse. I am here for a consultation about my type 1 diabetes.
All right. May I know your name and age for the documentation purpose?
Sure. My name is Mihira. I'm a 20-year-old student.
Thank you for your details. Could you tell me in detail about the purpose of your visit?
Yes, I'm going to study a farm-related course, and I'm worried about how to manage my condition there.
I see. Well, first of all, let me reassure you that you can still enjoy your farm studies and take care of your health at the same time. There are some things you need to be aware of and prepare for, but nothing that you can't handle with some planning and support. Can you tell me, what are your main concerns?
Well, I heard that it can get very hot and dry there, and I'm afraid of getting dehydrated or having a heat stroke. I also don't know if I'll have access to a fridge or a pharmacy to store my insulin and get supplies. And I'm not sure what kind of food they will have there and how it will affect my blood sugar levels.
Okay, those are all valid concerns, but there are ways to deal with them. Let's start with dehydration. You know that it's important to drink plenty of water throughout the day, especially when it's hot and you're sweating a lot, right?
Yes, I know that.
Good. So, make sure you always carry a water bottle with you and refill it whenever you can. You can also drink other fluids, like juice or milk, but be careful not to have too much sugar or caffeine. And don't forget to eat fruits and vegetables that have a lot of water in them, like watermelon, cucumber, lettuce, etc. They will help you stay hydrated and provide you with vitamins and minerals.
Okay, that sounds doable.
Another thing you can do to prevent dehydration is to avoid direct sun exposure as much as possible. Try to stay in the shade or indoors during the hottest hours of the day and wear a hat, sunglasses, and light-colored clothing when you go outside. You should also apply sunscreen cream or lotion with a high SPF factor every 2 hours or more often if you sweat. This will protect your skin from sunburn and reduce the risk of skin cancer.
I see. I didn't know sunscreen was so important.
Yes, it is, especially for people with diabetes, who may have more sensitive skin. Now, let's talk about your medication. You said you're not sure if you'll have a fridge or a pharmacy nearby, right?
Yes, that's right.
Well, the good news is that insulin can be stored at room temperature for up to 28 days, as long as it's not exposed to extreme heat or cold. So, you don't necessarily need a fridge to keep it safe. However, you should still try to find a cool and dark place to store it, like a cupboard or a drawer, and avoid leaving it in direct sunlight. You should also check the expiration date and the appearance of your insulin before using it. If it looks cloudy, discolored, or has particles in it, don't use it, and get a new one.
Okay, got it.
As for the pharmacy, you should always carry enough insulin and supplies with you for at least a week or two, in case of an emergency or delay. You should also have a prescription from your doctor and a letter stating that you have diabetes and need insulin. This will help you get access to medication and medical care if needed. You can also contact your local GP or the school health nurse if you have any questions or problems while you're away.
That sounds reassuring. Thank you.
You're welcome. Now, let's talk about your diet. You know that eating well-balanced meals and snacks is essential for managing your blood sugar levels, right?
Yes, I know that.
Good. So, try to follow the same dietary guidelines that you normally do at home. Eat regular meals and avoid skipping meals or overeating. Remember to check your blood sugar levels before and after meals and adjust your insulin dose accordingly.
Okay, I'll try to do that.
One more thing I want to mention is the importance of having a support network. You should let your friends and teachers know that you have diabetes and what to do in case of an emergency. You should also wear a medical ID bracelet or necklace that has your name, contact information, and medical condition on it. This will help others identify you and assist you if you have a low or high blood sugar episode or any other complication.
Okay, I'll do that.
Great. Do you have any questions for me?
No, I think you covered everything. Thank you so much for your help.
You're very welcome. I hope you have a wonderful time and learn a lot. Take care of yourself and stay in touch. Goodbye.
Goodbye. Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.